Welcome to the podcast show of the Nurse Practitioner Association, New York State. We will discuss everything from advocacy, legislation, to resources that you can really access at your fingertips, to helping you grow and thrive in the healthcare industry. Our new podcast will feature a new guest every 2 weeks, focused on relevant industry news and topics. I am Dr. Stephen Ferrara, and I'm currently the Executive Director of the Nurse Practitioner Association, New York State. Today's guest is our newly appointed and announced president, Efrat LaMandre. Efrat LaMandre is a family nurse practitioner that owns and operates her own family medical practice, EG Healthcare. Her practice includes pediatrics, primary care, geriatric care, and integrative medicine. Her integrative practice specializes in functional medicine and has a signature process called the New Method, where the focus is on empowering patients to take control of their health. The practice consistently meets and exceeds industry standards, receives hundreds of accolades, and has achieved the honor of patient-centered medical home status, indicating excellence in patient care. She is the co-chair of the Staten Island University Hospital Foundation Board of Trustees. The mission of the foundation is to achieve philanthropic relationships for support and endowment, providing highest quality care, services, and state-of-the-art equipment. It helps improve the hospital's healthcare, quality of life, and better serve the patients and their families throughout the community. She is the only nurse practitioner to sit on this board. In addition, she sits on the Regional Council Executive Board of Staten Island University Hospital Northwell Health. As an industry leader and entrepreneur, Efrat owns a medical scribe company called Hawk Scribes Company. Efrat is the newly appointed president of the Nurse Practitioner Association, New York State Board. In addition, she is clinical faculty at Wagner College. She is also the primary care provider for the City University, New York College of Staten Island Athletic Department. Welcome, Efrat.
Hi, thank you so much. What a great intro. Nice to hear my bio read out loud.
It's nice to read it. Well, it's great to see you, Efrat. I have a few questions for you today. First is, how did you get involved with the Nurse Practitioner Association?
I love that question so much. So how I got involved with NPA starts first with, how I opened up my own practice. Initially, I worked in a community health clinic that served a very underserved community, but it was in New Jersey. I love New Jersey, but it wasn't New York. So eventually I realized I wanted to bring my care into the community here in New York, and I opened up EG Healthcare. We started in a small side apartment with 5 patients a week, and now we own a sizable building and we take care of 20,000 patients. And the reason I mention that is for those of you who are listening, if you're dreaming about it, just do it. If you have questions, find me. But to your question then, how did I get involved with an NPA? Really, once I opened up EG Healthcare, it became clear to me that I have to get involved with the organization that actually made EG Healthcare a reality, right? Because there's no way that I would be able to independently own and run, as my bio says, my practice without the legislation spearheaded by the NPA. And so that's how I started. I started at the local level. I got involved in local meetings. Eventually, I became the regional president. Our focus there was really to get our NPs involved. So we started doing monthly dinner meetings. And I realized once the NPs start networking and get involved, then they also get really hooked on NPA's mission and start to understand the vision and hopefully get more and more involved with the NPA as I did.
That's fantastic. So we have your NPA journey. Take us back a little bit to how do you envision leadership and support of the Nurse Practitioner Association?
Okay, so on the state level, it's a whole new level, to my surprise, a whole new level of responsibility to the values of Nurse Practitioner Association. So of course, membership is still critical and just as important, but on this level, legislative matters become clear and important. So when you ask me how I envision it, I want to be able to bring the skills I've learned as a businesswoman to work in tandem with NPA leadership to ensure that we are in line with mission and to help further the NPA message.
Absolutely. And can you discuss Capital Day and the significance and importance of that day coming up?
That's a really good question, because I feel like a lot of NPs, a lot of humans don't know what Capital Day is. I didn't know before getting involved in the NPA. So for those of you listening, if you've never heard of it and you don't know, that's okay. I didn't know either. So this particular week is especially important because of the legislation that's coming up regarding our ability to practice at the top of our license. So what Capital Day does, it gives us an opportunity to send our message. The people who work in government are people. Their schedules are full. They have to know a million things all at once, and they may not be well versed in the issues that are important to the nurse practitioners. So it's our opportunity to let them know what's going on with legislation. So Capital Day is an opportunity for us to let them know how the legislation will impact their constituents, because this is not an NP issue. This is a constituent and a community issue. It's about ensuring that there are enough healthcare providers out there to provide care for those who need it most. So this legislation that's coming up now, and Capital Day allowing us to talk about this legislation, impacts every single person in the state of New York.
Thank you so much, President E, for joining us on our first episode of the podcast.
Oh my goodness, it was my pleasure. And I love how that sounds, President E. So I'm going to start having my wife and kids call me that. What do you think about that?
I think that's great.
I really appreciate the opportunity to be on the show. Thank you so much for your time.
Thank you.